PALLAS is the adjuvant study on palbociclib in addition to standard endocrine treatment. The background for this was that obviously palbociclib, as other CDK4/6 inhibitors, yielded great benefits in terms of progression-free survival and even overall survival in the metastatic breast cancer setting. So it was just logical to try to transfer these benefits to the curative setting in the adjuvant treatment. Unfortunately, we were disappointed because overall the result of the PALLAS study is negative. That was already indicated by a futility interim analysis about a year ago, and now it was confirmed in the final analysis based on almost 5,800 patients at the median follow-up of 31 months. We did not find a benefit for the addition of palbociclib. This is also true for all the subgroups and all the secondary endpoints. Logically, there was no difference in overall survival. You know, this is disappointing, and people discuss why is this trial negative, whereas in comparison, for example, Monarch E confirmed their 5% benefit at 4 years. And there is a number of reasons potentially explaining that. Number one could be that the risk distribution in these two trials is different. I don't think that's actually the reason, because even the highest risk cohort within PALLAS doesn't show a signal. It could be that the drug exposure is different. I neither believe that, because Penelope, also using palbociclib, also a negative trial, had a much better drug exposure as compared to PALLAS. It could be that just the two drugs are different, which many consider unlikely given that they have almost similar PFS benefits in the metastatic setting. So what I personally believe makes the difference is the different scheduling. Palbociclib, as ribociclib in the NATALEE trial that is forthcoming, is given in a 3 weeks on, 1 week off schedule, whereas abemaciclib is given continuously. And particularly in the early breast cancer setting, when we are not targeting proliferating metastases, but we are trying to catch awakening dormant cells, so to speak, that might actually make a difference. There's a huge translational program going on. We call it the TransPALLAS, which obviously will try to investigate further reasons for failure, or whether there would be a subgroup, either molecular defined or clinically defined, with longer follow-up where we can find a difference. And it's going to be a huge resource. I mean, after all, hundreds of caregivers in 21 countries collaborated in this role model trial. So despite a disappointing primary result, I consider this a great success.